So, ladies and gentlemen, we will begin the event. Thank you for joining us today to celebrate this special occasion. My name is Hae-jin Jung from the Korea Foundation for International Healthcare, or KOFIH. It is my great pleasure to briefly introduce KOFIH, the host of today's event, and to share with you the purpose of our gathering. The Korea Foundation for International Healthcare is a public institution committed to promoting global health and strengthening health systems around the world. So today we come together to honor the legacy of Dr. Lee Jong-uk, a pioneer in public health, and to recognize outstanding contributions made in advancing global health through the Dr. Lee Jong-uk Memorial Prize for Public Health. We sincerely thank the Geneva Health Forum for their invaluable support in organizing this event and for being an essential partner in facilitating dialogue and innovation in the field of global health. Now, let me take a moment to welcome our host for today. Dr. Il-Soo Ha is the president of KOFIH and a leading figure in advancing global health initiatives. Dr. Ha has been instrumental in shaping KOFIH's vision and expanding its global impact. He is an emeritus professor of pediatrics at Seoul National University, specializing in pediatric nephrology. Dr. Ha is recognized for his expertise and leadership in international healthcare cooperation, including major projects in Uzbekistan. It is under his leadership that KOFIH has continued to honor the legacy of Dr. Lee and to champion initiatives that bridge gaps in healthcare access around the world. Now, please join me welcoming Dr. Il-Soo Ha to deliver the opening remarks.
Dr. Margaret Chan, former Secretary General of World Health Organization, His Excellency Khoi Vani, Secretary of State, Ministry of Health of Cambodia, Dr. Jerome Kim, Director General of International Vaccine Institute, Dr. Juno Choi, Director General for International Cooperation, Ministry of Health and Welfare of Republic of Korea, Dr. Suraya Dalil, Director of Special Program on Primary Health Care, WHO. Distinguished guests, esteemed colleagues from WHO, South Africa, and Republic of Korea, whose names I cannot list here because of the limited time. And above all, this year's laureate, Dr. Helen Rees. It is a great honor to welcome you all to this laureate lecture, co-organized for the first time by Korea Foundation for International Healthcare and Geneva Health Forum, made possible through the kind collaboration of Professor Antoine Flo and Dr. Eric Comte. Dr. Rees is a globally respected leader and advisor in public health, widely recognized for her exceptional contribution to vaccines, infectious diseases, and reproductive health. As we are constantly reminded, global health faces increasingly complex and evolving challenges, and this requires evidence-based decision-making, timely action, and brave, strong international collaboration and leadership. In this context, insights and achievement of Dr. Rees are more relevant than ever. Alongside the valuable perspectives of our distinguished panelists, I believe that today's lecture and discussion will not only inspire us, but also help shape and guide our collective efforts in addressing the global public health challenges we have. Once again, I extend my heartfelt congratulations and deep appreciation to Professor Rees for her lifelong dedication to advancing public health. Thank you very much.
Thank you, President Il-Suha, for your thoughtful welcoming remarks. Now we will proceed with a series of congratulatory addresses from distinguished representatives of the global health community. First, it is my honor to introduce the Minister for Health and Welfare of the Republic of Korea, Jo Kyu-hong, who will share a message of congratulations and Korea's commitment to advancing global health. He will deliver the message virtually. Please welcome him with a round of applause.
안녕하십니까. 대한민국 보건복지부 장관 조규홍입니다. 이번 이종욱 기념 공공보건상 수상자 기념 포럼에 참석하시어 자리를 빛내주신 WHO, 주 제네바 남아프리카 공화국 대표부, 주 제네바 한국 대표부 관계자 여러분께 감사의 말씀을 드립니다. 또한 이 행사를 준비하느라 수고하신 한국국제보건의료재단 관계자 여러분께도 감사드립니다. 특히 오늘 포럼에는 마가렛 찬 전 WHO 사무총장, 지영미 대한민국 질병관리청장, 제롬 킴 국제백신연구소 사무총장을 비롯하여 국제보건 분야를 선도하는 전문가 여러분께서 함께해 주셨습니다. 이종욱 박사의 정신을 기리고 공공보건의 미래를 논의하는 자리에 함께해 주셔서 진심으로 감사드립니다. 이종욱 기념 공공보건상은 전 세계 질병 퇴치와 인류 건강 증진에 평생을 바친 제6대 WHO 사무총장 고 이종욱 박사의 헌신을 기리기 위해 대한민국 정부와 WHO가 공동으로 제정한 뜻깊은 상입니다. 오늘 이종욱 공공보건기념상을 받으시는 남아프리카 공화국의 헬렌 리스 교수님께 진심 어린 축하와 격려의 말씀을 전합니다. 이 자리가 아프리카 지역의 보건의료 환경 개선에 크게 기여한 교수님의 탁월한 업적과 헌신을 널리 알리고 앞으로도 행보를 이어가시는데 큰 힘이 되는 소중한 계기가 되기를 바랍니다. 대한민국은 앞으로도 글로벌 중추 국가로서 국제적 위상에 걸맞는 역할과 책임을 다하기 위해 노력할 것입니다. 또한 전 세계 공공보건 수준 증진을 위하여 WHO를 비롯한 보건의료 분야 국제기구 및 회원들과 긴밀히 협력해 나갈 것입니다. 이번 행사에 참석해 주신 모든 분들께 다시 한번 감사드립니다.
Thank you, our Minister, for your inspiring message. So next, we are pleased to welcome the representative of the Republic of South Africa, who will deliver a congratulatory address. So Dr. Precious Malebuna Machoso is a distinguished leader in public health and former Director General of the National Department of Health. Dr. Lee was the one who appointed her as a director in WHO, so it's very meaningful. She was the INB of pandemic agreement, which was just approved 3 days ago, so big achievement. With her exceptional expertise and visionary leadership, Dr. Machoso is perfectly positioned to offer heartfelt congratulations to our laureate. Dr. Machoso, please step forward to deliver your congratulatory remarks.
Good afternoon. It is truly an honor and privilege to congratulate Professor Helen Rees, a globally recognized, nationally revered, and regionally admired leader. A leader of note in public health, a leader of outstanding recognition in regulatory science. Some of you may not know that Dr. Rees has transformed lives, and he's called upon at every minute. He's relied upon by government of South Africa. He's been recognized by the president of the country and has received outstanding awards. But it's been Dr. Rees who went into the trenches and changed lives of women in South Africa. It is Dr. Rees who led the vaccines program in the African region. But it is the same Professor Helen Rees who has been at the forefront of SAGE. Dr. Rees, who has led fights against pandemics. In fact, the Wits University has recognized her contribution in global health for the past 14, 15 to 30 years. I have personally worked with her as my chair of the Medicines Control Council, but I've also worked with her in the institutions that we work for. But of note is her contribution to the work in WHO. In fact, I always ask, when do you get to sleep at home? Because do you work at the airport? But it is just her contribution where she consistently and steadfastly work and contribute to change lives, and in particular, women's lives. It is an honor and privilege to be the one recognizing you from our country. I thank you.
Thank you, Dr. Matoso, for your encouraging words. Wow. Yeah. Now we are honored to invite the representative of the World Health Organization, who will offer congratulatory remarks and reaffirm WHO's leadership role in shaping the future of global health. Dr. Suraya Dalil serves as the director of the WHO Special Program on Primary Health Care, which Dr. Lee was very emphasizing. Throughout her distinguished career, Dr. Dalil has been a tireless advocate for equitable access to health care and has played a leading role in strengthening health systems, particularly in low and middle-income countries. Her commitment to primary health care as a cornerstone for achieving universal health coverage reflects the enduring values championed by Dr. Lee Jong-wook. We are truly honored to have her with us today. Please join me welcoming Dr. Suraya Dalil to the stage.
Hello and good afternoon. Distinguished delegates, dear colleagues, dear friends, Mr. Il-Soo Ha, President of KOFIH, Dr. Mutsuto, dear Dr. Margaret Chan, good afternoon again. I would like to thank the Korean Foundation for Healthcare on behalf of WHO Director General for organizing this event. It's my pleasure to be with you today to congratulate Professor Helen Rees as this year's honorable recipient of the Dr. Lee Jong-wook Memorial Prize, a prize that honors the memory of Dr. Lee Jong-wook, who was the Director General of WHO 20 years ago from 2003 to 2006. From the WHO Special Program on Primary Health Care, we are thrilled to acknowledge Professor Rees' lifelong commitment to the health of communities that are most in need, with a strong focus on improving equity and access. Professor Riss, we extend our sincere congratulations to you for your exemplary dedication to public health, to primary health care, to innovation, and to equity. In South Africa, you have been designing and piloting novel approaches, proving concepts, and scaling up at the national level and beyond. Your commitment to equity is exceptional, focusing on the most marginalized communities, famously in the Hillbrow Health Precinct. Your scientific contributions are outstanding, covering childhood immunization, HIV, TB, COVID-19, to name a few. Importantly, you have taken every opportunity to use this experience to help shape national, regional, and global directions on tackling these diseases, making an impact at a larger scale. More people are living healthier, more fulfilling lives because of your passion and because of your accomplishments. Your scientific excellence is also well recognized. WHO and other international organizations benefit from that through your expert contribution to multiple international advisory bodies. You are a true health champion that we can all learn from and look up to. Equity is at the heart of the primary healthcare approach. Primary healthcare is the most effective, efficient, and equitable approach to improve people's life, health, and well-being. We need to continue to build a global community of PHC champions, and that's why I'm particularly excited that WHO is working closely with the Korean Foundation of International Healthcare on enhancing PHC leadership capacity in countries. This week, World Health Assembly is gathering around the theme of One World for Health. This week has been eventful with a strong focus on primary healthcare approach as critical to achieving universal health coverage and health equity. We have heard that in many statements from member states in the plenary and the two committees this week. Indeed, the adoption of the pandemic agreement is a major milestone for the multilateral cooperation of our time. We are delighted to recognize health champions and all those who contribute to health for all, such as yourself, Professor Riss. You have set an example of excellence and compassion over 4 decades of relentless efforts. We know that you will continue and reach further with your remarkable work, and we hope others will follow in your footsteps to achieve equity and health for all through primary health care. Thank you very much, and I wish you all the best.
Thank you, Dr. Dalil, for your meaningful and inspiring message. Now we move on to the highlight of today, the laureate lecture. I would like Professor Antoine Flahaut from Geneva Health Forum to introduce our honorable laureate for 2025. Professor Flahaut is a renowned epidemiologist himself and public health expert, currently serving as director of the Institute of Global Health at the University of Geneva. With decades of experience in disease surveillance, pandemic response, and international health collaborations, he is widely recognized for his leadership and insights in the field of global health. Please join me welcoming Professor Flahaut to the podium.
Thank you for your kind words, Mrs. Young. Each year, the Dr. Lee Jong-wook Memorial Prize for Public Health recognizes an individual who has made outstanding contribution to advancing public health and embodying the spirit and dedication of Dr. Lee Jong-wook. I thought it was a secret. I've been told it is a secret. Nobody should know the name. I thought I would have had an envelope and I would have disclosed it and said, it is with great honor that I introduce the winner of the year, Dr. Helen Rees. Dr. Helen Rees is a renowned global health leader and a tireless advocate for public health, with a career spanning decades of service in the fields of infectious disease, vaccine policy, and reproductive health. As a founder and executive director of the WITS Reproductive Health for HIV Institute, the WITS RHI, at the University of Witwatersrand in South Africa, in Johannesburg, Dr. Rees has played an instrumental role in advancing scientific research, shaping global health policy, and improving the lives of millions through her work on HIV, prevention, vaccine development, and women's health. Her leadership and commitment to evidence-based public health action perfectly reflect the values that Dr. Lee Jong-wook championed throughout all his life. We are deeply privileged to hear directly from her today. Ladies and gentlemen, please join me in warmly welcoming Dr. Helen Rees to deliver the laureate lecture entitled Caps and Gowns, Activism and Evidence in Public Health.